So let me ask this question to Kristine. Kristine, you've seen it. You've been in practice for a long time now. What are your takes on just kind of the chronic disease burden? But what can we be doing to try to move the needle to get people in the door sooner? People come and see you in your clinic, and there's already been medical challenges that have been going on. How do we kind of reverse this trend?
Well, let me take one step back. I wanted to say I went into weight loss medicine because of all the years in family practice. I would see patients that were suffering with the disease of obesity, but weren't yet ready to make the decision to act on it. And it was hard. It's hard to initially have that conversation with your healthcare provider. And so the years go by and the weight comes on more and more. So I think one thing is education. I think when you see your healthcare provider at a wellness exam, we are now doing body mass index, and this is a marker that determines obesity. It may not be the best marker, but it is out there. And right now, I think healthcare providers are alert to it. Schools are requiring this BMI to be on kids' forms for enrollment and sports. So I think the community is stepping up to this. But how do we get people going? Well, education is one piece, but I think there's got to be an element of I'm ready to do it and support. So support is essential. For a woman in her 40s, 50s, she's got sometimes children, she's got a full-time job, she's got a household. So trying to eat healthy, exercise, it's difficult. And unless you have support through friends or a spouse, it can be really challenging. So support, structure, schedule, these are things that we need to talk about with our patients. We need to discuss how do we go about doing that. Behavior change through one simple step. And I think that needs to be brought up by practitioners to talk about behavior change. Sometimes there's not enough time allowed for that, and that's unfortunate. But I think education, setting goals, expressing to patients in a clinic setting, hey, we know if you are diagnosed with obesity at a young age, you lose years of life. So for instance, you're 30 years old and your BMI is over 35, and that's not treated, you're losing 6 years of life. So we need to get to these patients sooner. Wow. Because then we're going to have diabetes and heart disease and
that's an amazing stat. I mean, and that is absolutely a fact, guys. That the years of life are taken off. Mm-hmm. And it's interesting when you mentioned about some of the barriers, Kristine, that even that we have as practitioners, we have some barriers because we may not want to bring it up or there's not time. And then on the flip side, patients may feel stigmatized, and so it may be hard to have that kind of discussion. And so you leave the office visit with your doctor and you never address the issue. Mm-hmm. And so that's just tough. So, but this is why I love doing this kind of stuff and say, hey, maybe there's something that you guys are hearing out there that are listening and say, you know what, I am going to mention, I'm going to make that a priority to mention that to my doctor next time I see them or next time I see my healthcare practitioner. But we have to do better, of course, as practitioners ourselves. Because we want to do this together, we were talking on air, Dr. Goulian and I about, no one person can just solve everything. You have to do it together as a community. And so that's why I like having this kind of discussion and getting other people involved that are like-minded. So let me ask you this question.